Now that you know how to stage a pressure ulcer, let's look at the other essentials of pressure ulcer assessment. To perform a complete assessment, note the ulcer's anatomical location and affected bony prominence, if any. Also locate and measure its length and width, or surface area, depth, and extent of tissue undermining, or sinus tracts, if any. And characterize the exudate and odor, if any, wound-based tissue, and peri-wound area. For accurate measurement, gently and cautiously insert a cotton-tip swab or gloved finger into the pressure ulcer. To document the wound's length and width efficiently, use a double-sided plastic or acetate measuring guide or a clear plastic food storage bag to trace the wound. Then separate the side that came in contact with the wound and discard it following infection control precautions. On the tracing, record the patient's name, date, pressure ulcer location, and an arrow that points toward the head so that subsequent tracings can be oriented properly. Make photocopies of the tracing to act as a permanent part of the patient's chart and as a visual baseline to help evaluate future wound changes. Also make a copy to document the medical need for skilled or subacute care, challenge Medicare denials in the home, justify reimbursement for wound dressings, and motivate the patient by helping him visualize his progress. When assessing the pressure ulcer, remember to describe the type, character, and odor of any exudate. A change in these characteristics can indicate infection, successful necrotic tissue liquefaction, and other changes in the ulcer. When assessing the wound base, estimate its tissue character in percentages. For example, a pressure ulcer may show 15% granulation tissue and 85% slough necrosis. 1 month later, it may have 100% granulation tissue. Documentation of these percentages tells the wound care team that treatment has been effective and that the pressure ulcer is healing. Finally, inspect and palpate the peri-wound area, documenting any denudement, maceration, or erythema. Measure how far they extend beyond the ulcer margin and describe their intensity. Thorough documentation helps satisfy state inspectors, third-party payers, and facility licensing boards. It may also deter lawsuits. Thorough documentation may prevent a lawsuit by showing the patient and his family that all reasonable measures were taken to manage a pressure ulcer. When a lawsuit is unavoidable, thorough documentation can help refresh your memory of the patient's care, possibly after many years, and could be used as evidence that you complied with the standard of care. What can happen without thorough documentation? Plenty. Consider the case of the 40-year-old man with multiple sclerosis who was admitted for care with 2 pressure ulcers at stage 1 and stage 2. Upon discharge 3.5 weeks later, his ulcers had progressed to stage 3. He sued, contending that the nurses had failed to follow the doctor's orders about timely repositioning, causing the ulcers to worsen. The treating nurse testified that although the record did not mention all ulcer treatments, this didn't mean that the doctor's orders weren't followed. In a bench ruling, the magistrate awarded the patient $60,000, noting that the hospital's records were abominable. Because pressure is the main cause of pressure ulcers, you can help prevent them by relieving pressure. In fact, you can do this in many different ways. For example, you could implement a 2-hour or more frequent turning schedule for a patient at risk for breakdown due to a mobility or sensory impairment. After turning the patient, remember to position the body correctly to relieve pressure on major bony prominences, and use pillows or foam wedges to support the knees, ankles, and other body parts, or prevent them from putting direct pressure against each other. If the patient's legs are immobile, also use a device that relieves pressure on the heels by raising them off the bed. As a reminder, create a clock that lists body positions and turning times. Set aside meal times for the supine position. To eliminate any confusion about right and left, identify the patient's positions as facing the door, facing the window, and lying on her back. This simple turning schedule also makes monitoring easier. If you identify patients' turning schedules with colored dots on their nameplates, compliance can be monitored during a quick walk down the hall. For an at-risk patient who's in a wheelchair, explain pressure ulcers and how to prevent them. For example, teach him how to lift up in the chair, shift his weight, or use the tilt-recline mode on a specialty wheelchair. If the patient can participate in his own care, provide a copy of the AHCPR prevention booklet for patients. This teaching aid can help ensure positive patient outcomes and a successful QA program. If possible, set a timer or watch to sound every 15 minutes to remind the patient to shift his weight. Otherwise, teach the patient and his family to relieve pressure at least every hour while sitting in a chair. Another way to prevent pressure ulcers is to control moisture from incontinence, perspiration, and wound drainage, which predispose the skin to breakdown. If moisture can't be controlled, gently clean the skin. Use non-plastic coated underpads, briefs, or dressings to absorb moisture and keep the skin dry. And apply a moisture barrier if needed. However, if the patient has dry, flaky, or scaling skin, apply moisturizer regularly because these conditions can also increase the risk of pressure ulcers. Perhaps the best way to prevent ulcers is to teach nursing staff members and family caregivers how to detect early signs of pressure ulcers, especially erythema over bony prominences. Advise them to be alert for these signs when giving the patient her daily bath, because that's the best time to systematically inspect the skin. Remind them to avoid massaging over bony prominences, and tell staff members to report early signs according to facility policy. The reporting procedure should be part of the nursing staff's orientation and the facility's QA program. Remember that legally, you have a duty to act reasonably. In terms of prevention, that means you must know your facility's policies and procedures on pressure ulcer prevention. Be up to date on journals and books about ulcer prevention. And use appropriate nursing care plans and nursing diagnoses related to pressure ulcer prevention. Otherwise, you could become involved in a case like the one in which a diabetic patient developed pressure ulcers on both heels during a 2-week stay at a hospital. The plaintiff claimed that the ulcers, which led to amputation of both heels, resulted from the defendant hospital's failure to follow pressure ulcer care protocols. Although the defendant argued that diabetic patients often develop pressure ulcers despite proper precautions, the jury returned a verdict of $125,000 in favor of the plaintiff. The importance of knowing current prevention and management techniques can't be overstated. Even if your facility doesn't use every current technique, you should be able to identify them.